Assalamualaikum everyone, welcome back to my YouTube channel. Let's start the video. Ossification of the bone. Two halves of the frontal bone are separated by metapoic suture. The mandible is also present in two halves. It is a derivative of first branchial arch. Occipital bone is 1/4 parts, squamous 1, condylar 2 and basilar 1. The four bony elements of the temporal bone are separate except for commencing union of the tympanic part of squamous and petrous parts. The second center for the styloid process had not appeared. On ossified membranous gaps, a total of the 6 frontalis at the angle of the parietal bone are present. Squamous suture between the parietal and the squamous temporal bone is present. Now we will talk about postnatal growth of the skull. The growth of the calvaria and the facial skeleton proceed at different rates and over different periods. Growth of calvaria is related to the growth of brain, whereas that of the facial skeleton is related to the development of dentition, muscles of the mastication and of tongue. The rates of the growth of the base and the vault are also different. Now we will talk about the growth of the vault. First of all, we will discuss about growth of the vault, in which we will talk about rate, growth in the breadth, growth in the height and growth in the anterior-posterior diameter. When we talk about the rate during the first year and then it slows up to the 7th year when it is almost of adult size. Growth in the breadth, this growth occur at the sagittal suture, sutures broadening greater wings, occipitomastoid suture and the petro-occipital suture at the base. Third one is growth in the height. This growth occurs at the frontozygomatic suture, pterion, squamous suture and ostrion. Growth in the anterior-posterior diameter. This growth occur at the coronal and lamboid sutures. Growth of the base. The base grow in the anterior-posterior diameter at 3 cartilaginous plates situated between the occipital and sphenoid bones, between the pre and the post sphenoid and between the sphenoid and ethmoid. Growth of the face. Growth of the orbits and ethmoid is completed by 7th year. In the face, the growth occurs mostly during the first year, although it continues till puberty and even later. Closure of frontals. Anterior frontal brachma closed by the 18th month, mastoid frontal by 12th month, posterior frontal lambda by 2 to 3 months and sphenoidal frontal also by 2 to 3 months. Clinical anatomy. Frontals help to determine the age in 1 to 2 years of the child. Help to know intracranial pressure. In the case of increased pressure, bulging is seen, and in case of dehydration, depression is seen at the site of frontals. Now we will talk about the thickening of the bones. The two tables and dipole appear by 4th year. Differentiation reach maximum by the about 35 years when the diploic veins produce the characteristic marking in the radiographs. Mastoid process appear during the 2nd year and the mastoid hair cells during the 6th year. Obliteration of the suture of the vault. Obliteration began on the inner surface between the 30 and the 40 years, on the outer surface between 40 and 50 years. The timings are variable, but it is usually take place first in the lower part of the coronal suture, next in the posterior part of the sagittal suture and then an lamboid suture. In the old age, the skull generally becomes thinner and lighter, but in small portion of the cases it increases the thickness and weight. The most striking feature is the reduction in the size of the mandible and maxilla due to the loss of the teeth and absorption of alveolar process. This causes decrease in the vertical height of the face and change in the angle of the mandible, which become more obtuse. Six difference in the skull we will discuss in the next video. If you have any query about this, you can ask me in the comment section. Thank you so much for liking and watching the video.